Morning, everyone. It's great to see so many people in the Zoom room. Day 2 of the Mid-Atlantic Public Health Partnership Conference. I'm Stephanie Schell, Executive Director of the Pennsylvania Public Health Association, and I'm so pleased to turn things over to my colleague and friend, Tim Gibbs from Delaware, who's going to get us started this morning. Tim?
Well, good morning, everyone. Tim Gibbs from the Delaware Academy of Medicine and the Delaware Public Health Association. Thanks for joining us this morning. Welcome to the second day of our regional conference. For those of you who joined us yesterday, we hope you enjoyed the speakers, the discussions, the breakout rooms, and the networking. While we have just a half a day together today, it's going to be a full one. First, I want to thank our conference sponsors, and that would be Highmark, Delaware, Christiana Care, AmerisourceBergen, and the Mid-Atlantic Regional Training Center. I also want to note the presence of representatives from CMS, HRSA, NIH, SAMHSA, and the CDC. We appreciate all that you do and your involvement in this conference. Before we start today's program, I want to thank our partners at the Maryland and Pennsylvania Public Health Associations. When we started planning this in the late fall of 2019, we had no idea that COVID-19, civil unrest, and other crises were just around the corner. Our partnership has been a source of strength and hope for a brighter, healthier tomorrow for the region, and we in Delaware are very grateful to you. I also want to thank our colleagues at the American Public Health Association, our national home. The leadership and work of APHA reverberates from Capitol Hill in Washington to our own state capitals. And now it is my honor to introduce my colleague, Dr. José Ramón Fernández-Peña, President of the American Public Health Association. Dr. Peña is president of APHA. He is also director of health professions advising at Northwestern University, where he leads the university's efforts to support students interested in pursuing careers in the health sector. Dr. Fernández-Peña is an associate professor emeritus of the Department of Health Education at San Francisco State University, where his work focused on health workforce diversity and cross-cultural communication in health. Prior to this, he worked at Mission Neighborhood Health Center in San Francisco as director of health education. Before arriving in California, he was associate director for quality management at the Bellevue Hospital Center in New York City. He is the founder and executive director of the Welcome Back Initiative, or WBI, a program to assist immigrant health professionals already living in the U.S. through the necessary steps to enter the U.S. workforce. He has advised the White House Domestic Policy Council on economic integration of foreign-trained professionals and continues to serve as an expert panelist on this topic at national and international forums. Dr. Fernández-Peña earned his medical degree from the National Autonomous University of Mexico and his master's degree in public administration from the New York University. Dr. Fernández-Peña, welcome, my friend.
Thank you, Tim, and good morning, everybody. It's really a pleasure to be here. You're my first official visit of the year. So, and it's bright and early here in Illinois. And I bring you greetings from APHA and more concretely from Dr. Benjamin and from Dr. Diana Wathington, the new chair of the board, and Dr. Aaron Guest, the speaker of the governing council. Before I begin my comments, I would like to take a moment to acknowledge and honor the people of the Council of the Three Fires, the Potawatomi, Odawa, and Ojibwe, the original people of the land upon which the city of Evanston was built, and this is where I'm coming to you from. And though I do not hold a native identity myself, I acknowledge the land to express gratitude and appreciation for the first caretakers of it, and to encourage you to learn all about the long history of this region. When I spoke with Tim a couple of days ago about what I was going to be talking about, it seemed such a natural connection between the work he does and the work I do. We found that we have a number of common points in history. And one of the things that I want to do first is to thank you for all the work you do in your respective states, and also for your partnership with APHA. You amplify the work that we do as an association. And I think that perhaps even more importantly, you are a reliable source always of reality checks to our offices in BC. You're really where the rubber meets the road, and that perspective is not always apparent when we have meetings in a room that has hardly any windows. We would not be complete without this symbiosis, so a heartfelt thank you to all of you. A bit of news from APHA. I don't know how many of you attended maybe the COVID-19 conversation webinar series that we held in partnership with the American Academy of Medicine in 2020. Those were really quite remarkable. And the next one in this series is scheduled for January 19th at 12 noon. All this information is posted on the APHA website. We also had our series of webinars on racial equity, and along those lines, another webinar that we have coming up on February 9th will focus on race, how race is utilized, reported, and interpreted in biomedical research. Another thing that is coming up real soon, before we know it, it'll be April, we have our Policy Action Institute, and that's a great opportunity for not only us older professionals, but certainly for students and for early career professionals. That will be on April 8th and 9th. I'd also like you to know that APHA has been in direct communication with the Biden transition team and with its coronavirus task force. We have also been working with the Beaumont Foundation to develop toolkits in English and in Spanish to assist in the development of targeted vaccination efforts. We were quite present and quite vocal during 2020 regarding the distinction between myths and evidence-based knowledge, learning, and practices at a time when it was so important to shine a bright light on truth and try to work very hard against lies and myths. I know that many of you in your local regions have also been very active, and even though we're looking to better days coming ahead, I think it's important that we all remain vigilant with regard to how we talk about the epidemic, how we talk about other factors that are clearly involved in where we are today. For the past 10 months, I'm sure there will be something that all of us will remember for the rest of our lives. Those of us that were around in the 1980s, this time can easily be a reminder of the early days of the AIDS pandemic. For me, it was the first time that I experienced a combination of fear, of anger and frustration. And as a newcomer to the United States, I was also paralyzed as what do I do with this fear and this anger that is in me. And a friend very wisely encouraged me to join a community-based organization that was actually doing something to prevent the spread of the virus. GMHC, the Gay Men's Health Crisis, was offering assistance and support to people living with HIV. And it had at the time the top-notch prevention programs, probably not only in the country, but in the world. It was the first, the logo is always said, first in the fight, the first community-based organization that actually started working on this in the vacuum of leadership. It was a call to action. They were involved in advocacy, in services, and trying to secure funding for services for the populations that were most affected by the virus. The vacuum of leadership that I was talking about ultimately led to the deaths of 32 million people around the world, and today about 40 million people are living with HIV. We still don't have a vaccine nor a cure. Of note, there's 30 million people in the world living with COVID-19 today. Some of the most important lessons I think I learned during those years have guided my work and sustained me and keep me focused during this time we are living today. And these are that prevention is key, that diversity in the health workforce can determine and does determine access to the health services, and that advocacy is imperative. It must be pretty obvious how this is relevant today, but some of the things that I think about is that just like in the 1980s, the federal government has shown no interest at all in developing a national prevention strategy. It's refused to speak about the virulence of this coronavirus and refusing to model safer behaviors. And this has not only delayed, but has unnecessarily politicized safer choices and behaviors. Like back then, the small number of providers at all levels that come from the populations most at risk creates in and of itself barriers to the treatment and reinforces mistrust in service agencies. The need to develop culturally and linguistically appropriate prevention programs is equally hampered, as is the implementation of effective contact tracing programs. This impact of the lack of diversity in the health workforce is especially severe in the context of our mental health services, where definitely if you do not have the language that people feel in, you essentially have no services in regards to mental health services. Also, like with HIV, the dangers of living in a country where access to health services is most often contingent upon employment is once again exposed in this pandemic. Back then, with HIV, homophobia was the main driver in the early days of the AIDS crisis, and today we see the impact of racism and racist practices in all that enables in all the enablers that feed the spread of COVID-19, from housing to educational attainment. So much to do, so little time. So something I learned during this year's working in HIV as well was the importance of self-care. And I think that at a time where so many of us are dancing dangerously close to the edges of professional and emotional burnout, it is critical that we look out for each other and for ourselves. And I understand that this is easier said than done. But I do ask you to make sure that we take care of ourselves. We will be of no use if we burn out to a crisp in these times. I think that in the next 5 days, hopefully we'll be in a time where our jobs are not being threatened or our personal lives are not being threatened, but I ask you and I urge you to take care of ourselves. We need you now more than ever. Thank you.
Thank you so much, Jose. I'd like to now turn things over to Lauren Nestler from PHMC to introduce our esteemed speakers for this morning. Lauren.
Thank you so much, Stephanie. And good morning, everyone. I'm pleased to be asked to introduce this morning's panel, and just want to thank Stephanie, Tim, Jody, and the Pennsylvania, Delaware, and Maryland Public Health Associations for putting on this excellent conference. My name is Lauren Nestler. I'm the Chief Communications and Strategy Officer with the Public Health Management Corporation. I'm thrilled to join you all this morning and introduce today's keynote panel. We have public health leaders from Pennsylvania and Delaware, along with a national expert to weigh in on the emergent public health issues facing our region, including but not limited to COVID-19. We will hear from each of our panelists and then engage in a Q&A session. Please remember to put your questions in the Q&A box as you listen so that we can make sure to prioritize the issues that are of greatest importance to you. And with that, I'm pleased to introduce today's esteemed panel. First, Dr. Rachel Levine. Dr. Levine is currently the Secretary of Health for the Commonwealth of Pennsylvania and Professor of Pediatrics and Psychiatry at the Penn State College of Medicine. Dr. Levine is a Fellow of the American Academy of Pediatrics, the Society for Adolescent Health and Medicine, and the Academy for Eating Disorders. She is also the President of ASTO, the Association of State and Territorial Health Officials. Dr. Levine joined the Wolf administration in January 2015 as the Physician General of the Commonwealth of Pennsylvania and served from 2015 to 2017. She was named Acting Secretary of Health in July 2017 and confirmed as Secretary of Health in March 2018. Her previous posts included Vice Chair for Clinical Affairs for the Department of Pediatrics and Chief of the Division of Adolescent Medicine and Eating Disorders at the Penn State Hershey Medical Center. In addition to her recent posts, Dr. Levine is also an accomplished regional and international speaker and author on the opioid crisis, medical marijuana, adolescent medicine, eating disorders, and LGBT medicine. Dr. Levine graduated from Harvard College and the Tulane University School of Medicine. She completed her training in pediatrics and adolescent medicine at the Mount Sinai Medical Center in New York City. Welcome, Dr. Levine. Next, I'd like to introduce Dr. Karyl Rattay, who is the Director of the Delaware Division of Public Health. Rita M. Landgraf, Secretary of the Delaware Department of Health and Social Services, appointed Dr. Rattay on May 3rd, 2009. As DPH Director and Delaware's State Health Officer, Dr. Rattay leads 630 employees. Dr. Rattay is board certified in pediatrics and preventive medicine. Prior to her appointment, she worked at Nemours Health and Prevention Services, where since 2004, she led its childhood obesity initiative and efforts to prevent overweight in primary care settings. Dr. Rattay also provided weight management clinical care at the Alfred I. DuPont Hospital for Children in Wilmington, Delaware. Welcome, Dr. Rattay. And last but not least is Dr. Joshua Sharfstein. Dr. Sharfstein is Vice Dean for Public Health Practice and Community Engagement, Director of the Bloomberg American Health Initiative, and Professor of the Practice in Health Policy and Management. Previously, he served as the Secretary of the Maryland Department of Health and Mental Hygiene, the Principal Deputy Commissioner of the U.S. Food and Drug Administration, as Commissioner of Health for Baltimore City, and as Health Policy Advisor for Congressman Henry A. Waxman. He is an elected member of the National Academy of Medicine and the National Academy of Public Administration. Welcome, Dr. Sharfstein. And now I'd like to turn it back to Stephanie to begin today's discussion. Thank you.
Great. Thanks so much, Lauren. I have to admit, I'm a little nervous this morning with like so many public health heroes in the room. So thank you all for being here. We're going to go big to little to start with and start with Dr. Sharfstein, who's going to give us a national perspective on where we are with coronavirus, public health, anything else. And then we'll turn to our state public health heroes, Dr. Levine and Dr. Rattay. As our speakers are speaking, I really encourage those of you listening to put any questions you have in the Q&A box that you can find at the bottom of your screen. We're going to get to as many as we can this morning. And this is such a phenomenal opportunity to be able to ask directly of our public health leaders. So with that, Dr. Sharfstein, I'd like to turn it over to you.
Thanks so much, Stephanie. And I want to thank Dr. Fernández-Peña for his inspirational words, and also really deeply appreciate the work of Dr. Levine and Dr. Rattay out on the front lines of public health at this incredible moment for the country and the world. So I'm just going to try to set the big picture here. It's about 1 year since we started learning about a new virus, and it has transformed so much about not only our lives, but about our field in public health. We've certainly learned something that we've known, but very intensely, that what every person decides to do makes a huge difference. And whether people wear a mask, whether people keep distant, those things really matter. But we've also learned that what we do together makes a difference. It's not just individual decisions. It's what communities, cities, counties, and states decide to do that makes a difference. And we've seen not only evidence that wearing a mask works, but that mask mandates work, and that policies together to respond to the virus have an impact on cases, hospitalizations, and deaths. We've learned the very hard lesson that when things are polarized, it's hard to do both. In the setting of so much disagreement, doubting of science, political polarization, people don't do what they should do for themselves. And it's very hard for public health and elected leaders to come together for policies. And that's been a challenge in every state and every county. And we've also seen over this last year how important equity is, because diseases, pandemics expose as much as they cause problems, and they've exposed enormous rifts in vulnerability to disease of all kinds, and the just staggering increases in rates of death, 2.8 times higher for African American and Latinos, are, kind of just one dimension of that. Every part of the response has reflected inequity, from inequity in testing, inequity in medical care, inequity in death. And I'm going to talk for a second about inequity in vaccine access. So this is another major theme. Public health is at the center of all of these challenges, and the difficulty that public health has had reflects how hard it has been to keep these different areas moving forward, particularly at the time that we're in the United States. And so hundreds of public health officers have quit or been fired. Many have been harassed. It's been a dismal experience for people in our field. People go into public health because they want to wake up in the morning and have an impact on the lives of their fellow citizens, even if those people don't know that they're alive or healthier because of public health. That's okay. We don't have the, the sirens or the uniforms, but it's the work that makes a difference. And to have people kind of turn on that often in ignorance and misunderstanding and be really vicious is really tough. And it's tough not just for the senior people, but people at every level in an organization. And for people who have persisted through this, it's really just remarkable that you have done that. And I think it reflects that public health as a field is really dependent on some basic understandings that exist in society. And without those, without some level of comedy and collaboration, public health becomes a very difficult field to work in. Let me just conclude by just turning to the vaccine for a second, because I think all of these themes are coming back for the vaccine. We know that what each person decides is very important, and understanding at an individual level the reluctance or hesitancy some people may have, their eagerness to be vaccinated, is going to be important for their individual decisions. Really being patient, answering people's questions, finding every possible way to work with their community organizations, churches, other units to get to them, to be there about vaccine information. So important. But it also matters what we do together. Do we design a fair system of vaccine access that really works? How do we make sure that there's enough vaccine for people who may be a little reluctant but really need the vaccine, and that we can really take the extra time for them as well? I think that gets into the equity considerations here. I'm a little worried that if we're just focusing on the number of people vaccinated, we've got to get more people vaccinated. We're going to vaccinate the easiest to vaccinate, the people banging on the doors of the pharmacy. And we're going to miss the fact that there are communities and pockets of people who really need vaccination, maybe a little reluctant, would get vaccinated with some extra effort. We have to find the space, resources, and vaccine to help them also. And finally, this will not be done without public health. There are different aspects, unfortunately, in the United States. We've been ready to max out the medicine credit card on taking care of sick patients with COVID. As many as that can come in, we'll build more hospitals, we'll do everything we can until the system is at the point of breaking. But medicine and the medical system alone can't get to these questions of vaccine confidence, or vaccine access and equity like public health can. So as difficult as this year has been with heroes like the ones you're going to hear from, I think we're in for another period of time, but one where public health is playing as important a role as ever. Thank you.
Thank you so much, Dr. Sharfstein. And with that, I'd like to turn it over to Dr. Levine.
Well, good morning. Thank you so much for inviting me today, and it's a pleasure to be on a panel with people I know well, with Dr. Rattay, Dr. Sharfstein, and it's nice to see you, Dr. Fernández-Peña. Great minds think alike, and I agree with everything that Dr. Sharfstein said. What this pandemic has certainly shown us is how interconnected we all are, and that we really have a personal and collective responsibility towards each other and towards the common good. We are blessed with tremendous freedoms in our nation, but since the founding, that freedom is associated with responsibility to the common good of Pennsylvania and the common good of our nation. The measures that we have been trying to promote, such as wearing a mask, washing your hands, social distancing, and avoiding large and small gatherings, these are not political issues. These are not partisan issues. These are public health issues. And I think one of the challenges that public health officials have faced nationally, statewide, and locally has been the politicalization of this process. So now the election is over. The people have spoken, whether that's nationally, statewide, or local races. And so hopefully now we can concentrate on what we need to do together to stand united together to be able to stop the spread of this virus. So Pennsylvania is continuing all of our public health missions in regards to COVID-19. We are working on containment, which includes, of course, testing and contact tracing. We're continuing our mitigation efforts. And of course, now we are all directed towards the vaccine, as Dr. Sharfstein said. I think that this is probably the most complex public health mission that the country has seen. It involves a public-private partnership as well as partnerships between federal, state, and local public health officials. But I know all of us are committed to accomplishing this mission and getting really the country, and from my perspective, Pennsylvania, vaccinated. I agree completely, again, with Dr. Sharfstein that health equity is absolutely critical in terms of our public health response to COVID-19 and actually our public health response in all regards. And what this pandemic has shown us is sort of the iceberg below the water and the health disparities that exist in Pennsylvania and throughout our nation. It really highlights vulnerable populations, minority populations in African-American community, Latinx community, in other states, the Native American communities that have suffered from health disparities for many years, particularly because of institutional racism, but also have that has been highlighted in terms of COVID-19. We know that minority communities and vulnerable communities have higher rates of infection. They have higher rates of comorbidities, higher rates of more severe disease, and tragically higher rates of death. And we have to take that in consideration as we develop all of our programs, including testing, including contact tracing, including mitigation factors, and of course now the vaccine. In Pennsylvania, we have a health equity task force for the Department of Health with many stakeholders throughout the state. We collaborate with the Governor's Health Equity Task Force, which is led by the Lieutenant Governor Fetterman. And we have many, many colleagues and stakeholders that we work with. I'd like to highlight one, which is the Black Pittsburgh 19 COVID Coalition. I have had the pleasure to have monthly meetings with them, and they work in Pittsburgh and in Allegheny County. We collaborate with Dr. Deborah Bogan, the Commissioner of Health for Allegheny County, but also many stakeholders, FQHCs, Pitt School of Public Health, and others. And we have worked on expanding testing in that area. We've worked on culturally competent contact tracing with appropriate isolation and quarantine, how to get the message out about mitigation measures such as masks, etc. And now we're working on making sure that the vaccine is equitably distributed. I think that all of these factors highlight the social determinants of health. All the social factors that influence health that we think of as maybe devoted to another department. We need health in all policies. So from our perspective, a living wage and economic opportunity is a health issue. Housing is a health issue. Transportation is a health issue. Education is a health issue. Of course, nutrition and the environment, all of those are health issues, and all have been impacted by COVID-19. I am a positive and optimistic person, and what I'd like to finish with is that I think that we have a unique opportunity right now to stand united in Pennsylvania and as a country. And I think that as we stand united and we work together, we will be successful in this public health battle against COVID-19. Thank you.
Thank you so much, Dr. Levine. And now I'd like to turn it over to Dr. Rattay. Dr. Rattay, we can't hear you, so I'm not sure if you're muted or...
Yeah, sorry, can you see the PowerPoint I just pulled up?
We can. You might want to put it in full screen though.
Oh, thank you. Yes, indeed. Okay. First of all, thank you so much for being here. It's really great to be on the panel with two of my favorite all-time public health colleagues and pediatric colleagues. When I was thinking about this early this morning, I was thinking about when I began in this role in 2009. Right as swine flu or H1N1 was hitting our state, and one of the first things that was said to me was, you're going to be the incident commander. And I remember thinking, what is that? We've come a long way in Delaware. I've come a long way. I'm so grateful for public health preparedness and the investments that have been made. I think some of my comments are going to be around the public health infrastructure and how a disinvestment or a lack of investment in public health infrastructure really makes it very challenging to respond in situations like this. So, our mission is to protect and promote the health of all people in Delaware, and our vision is healthy people and healthy communities. And I highlight that because, we often in non-pandemic times, at least in our division, and I personally really focus on health promotion and disease prevention. But this protection piece is so critically important, and especially at a time like this, where we're all hands on deck, just seeing how we can save as many lives and prevent as much hospitalization as absolutely possible. And so prior to the pandemic, our strategic priorities were promoting healthy lifestyles, achieving health equity, and reducing substance use disorder and overdose deaths. And as this pandemic came upon us, these are three areas where, had we maybe not focused on these, we would be doing worse. However, had we been able to make more headway around overweight and obesity, or equity, or opioid use disorder in our state, the devastating impacts that this pandemic has had on us would have been improved. And so it really speaks to why prevention and addressing these key strategies, especially equity, and I'll talk a little bit more about that as I move forward. But we have to once we get out of this and into a better place, it's clear that these are strategic areas that we must continue to focus our efforts on. So I want to talk a little bit about kind of the different facets of our response, and how critically important these pieces of a public health infrastructure are to being able to respond 24/7 all of the time, but especially during a pandemic. So communications is just so critical to what we're doing. The more transparent, the more information we can get out there to the public, the better. The more we're able to educate and to help bring more people on board, the more of a difference that we can make, for sure. So along with that is the data. And I will say, in Delaware, I think this has been one of our greatest challenges. This is one of the areas where I feel we were probably the weakest as it relates to our public health infrastructure. Prior to the past year, we had not had master's degrees in epidemiology in our state, and it's always been difficult for us to hire epidemiologists, which becomes even painfully more of a problem in a situation like this. And then the data infrastructure, you have to invest. We have to, as a society, invest in a strong data infrastructure. And I think most all states, but especially in Delaware, we really struggled to be able to get the data we needed. Our data system for reportable diseases, often we get several thousand reportable diseases each year, many of them STDs. look at us now. We're, we have over 1 million test results in our system, and we're struggling with the data system to support that. And that would be the same with our lab. Has needed to expand to almost serve as a commercial lab, and as we all see, testing has been a huge part of what we've needed to do. Standing up contact tracing to the level and degree that we have now at this point, I think is something that probably most of us never imagined that we would need to do. I want to move quickly through these, but I just will say that, a large amount of our energies have focused on hospital surge and medical countermeasures, especially, recently the vaccine, which is, I think, most of us are spending probably a good 95% of our time on this complex vaccine initiative. But of course, the non-pharmaceutical interventions have been a key part of how we've invested our efforts, as well as enforcement. And we in public health, I think Rachel would say the same. I mean, we don't usually regulate gyms. We don't regulate youth sports. We're now regulating almost everything. And that is a unique role for us to be in, and one in which, we had nowhere near the level of staff that we needed to support this. And I mentioned everything else in here because I think we've been doing things this past year that we never imagined that we would need to do. We have written guidelines for just about everything. And I could talk a little bit about all the hate email we all get. We all get a lot of it, but one that was astonishing to me was, a group was very angry at me because I hadn't established guidelines for bands, marching bands. And I was like, oh my gosh, like when did public health get in a position where we have to write guidelines for marching bands? I want to just quickly finish, and Josh really started with this around acting with a sense of community. And when I think, and my guess is Rachel could say the same, so much of the kind of angry emails, the hateful emails we get almost always have a tone of selfishness. And I think that so much of our society really has tried to act with a sense of community, but it is pretty eye-opening to see how many people don't, and how many people have approached this from how does this affect me? I'm very mad that as a grandparent, I can't see my grandson play football. Why are you making me wear a mask? It's, a violation of my human rights. And I think what's just been very eye-opening to me, and frankly, I plan to write a book on this aspect of this pandemic, is how it is really hard for people to see what kind of their duty is to serve the public good, to be a part of the public good, and supporting that our neighbors, as opposed to just the impact on ourselves. So with that, I'm going to stop, but I again just want to thank you for the opportunity to maybe vent a little.
Well, thank you so much, Dr. Rattay. And thanks to those of you who are putting questions in the Q&A box. We're going to get to as many as possible. And I know, all of them are going to be about coronavirus, but it is Friday morning. It's the Friday morning starting MLK weekend. And so let's start with a question that's bigger, broader, and a little more forward thinking. And Dr. Rattay, since you're already sort of unmuted and on camera, let's start with you. The question which we'll pose to each of you is, as a top public health leader in this country, in your state, what are you most looking forward to in 2021 as we kick off this year? Dr. Rattay?
Thanks, Stephanie. So I am super excited about the vaccine initiative, even though it is complex and we're all taking a ton of, I feel, unfounded heat right now. It brings me joy. We've been able to vaccinate 90% of our school nurses in Delaware, and I've recently received some really nice emails from school nurses, and it just it brings me joy to get to, you know, vaccinate people who are on the front lines or people who are vulnerable. So, you know, I'm really excited to continuing to roll that piece out. But I'm also looking forward to hopefully getting, I mean, it's been in some ways good for public health to get the attention that we've received this year. People now know what an epidemiologist is, but it'll be nice to get less public attention at some point and maybe to take a couple of days off without my phone. So that's what I'm looking forward to.
Thank you, Dr. Rattay. Dr. Levine? Oh, you're muted. We're not.
Yep. So thank you for that question. So I am also very much looking forward to continuing our distribution and administration of the vaccine. You know, Operation Warp Speed in terms of developing the vaccines was a tremendous success. I mean, in less than a year, we have 2 safe and effective vaccines. We have 2 more that will hopefully go to the FDA for consideration this spring. And so that really is tremendous. It also highlights the importance of vaccinations. And as pediatricians, we certainly know the importance of immunizations, and which really have been one of the public health triumphs of the 20th and now the 21st century. And we can prevent so many diseases that I remember treating as a pediatrician. I'll give you one that people don't usually think of, and that's HIV or Haemophilus influenza type B. When I was a house staff member, we used to see many children and infants with sepsis, with pneumonia, with meningitis and other infections due to Hib. And now, you know, house staff never see Hib disease because of vaccinations. And to dovetail off something Dr. Sharfstein said, you know, I think the pandemic has certainly highlighted the critical importance of public health, both from a federal level, a state level, and a local level. And hopefully, you know, we're getting much better funding now. We're tremendously grateful to the funding in the new stimulus package, although none of us have gotten that money yet. We're still working through the application process for the CDC to actually obtain the money. But what we're going to need is ongoing sustainable funding even after the pandemic ends for personnel, for laboratory capacity, for data, improvement in data systems, which are woefully inadequate, and that's clearly been shown. So ongoing federal, state, and local support for public health now and in the future. Thank you.
Thank you, Dr. Levine. Dr. Sharfstein?
Unmute here. So I'm pretty excited by the announcement yesterday by the president-elect that there's going to be major investment in the public health workforce as part of this legislation. I really hope it goes through. I think that could be really transformational. You know, public health infrastructure, pretty weak heading into the pandemic, exposed for being pretty weak during the pandemic. And this is a chance when, you know, trillions of dollars are on the table for the country to start to reinvest in public health. And part of the idea is to bring in community health workers into public health in great numbers. And I think that is, first of all, super helpful for some of the outreach that'll be necessary around the vaccine and testing and other things for COVID, but then keeping that workforce around and having it, in a way, reshape the field of public health in a way we couldn't do because we didn't have the resources is really promising. And, you know, I have no doubt that this year will change the field of public health dramatically. I don't know exactly how, but one potential scenario is that it really reshapes the HR of public health and the understanding people have of who is in public health. And I think that's something hopefully to look forward to and fight for as the legislation moves through.
Great, thank you so much. And thanks to everyone who's putting so many phenomenal questions in the Q&A box. I know we're not going to get to all of them. Let's dive in. So I think let's start with you, Dr. Levine, if you don't mind, with this next question. The question comes from Kaylee McLeod and is, I'm going to read it just the way Kaylee wrote it. Many Black and brown folks carry deep mistrust due to historical unethical treatment at the hands of medical professionals. While there are state level initiatives, what can we as public health professionals do to support these folks without shaming them while also encouraging the vaccine? Dr. Levine?
Well, thank you for that question. I mean, certainly we need to to work with vulnerable communities. We need to work with the African American community, with the Latinx community, and others. I think that the best thing that we could do is work with community stakeholders. And so again, highlighting, because I just think they do such a great job, the Pittsburgh Black COVID-19 Coalition is they have community stakeholders, again, from local physicians, from FQHC leaders, public health leaders in the community. We have engaged the faith community, and so I think that that we have to go local and engage the significant leaders in those communities as we work to address their public health needs. I think if we come in as the experts and we know what to do, I mean, that's happened for decades and for generations with people telling certain communities what to do. I think that we have to work with from within. I think that that's also true, of course, in Philadelphia, and we collaborate with Dr. Tom Farley in Philadelphia. We've worked with Dr. Sanford, who's done a great job in terms of testing and other public health measures in Philadelphia. And we have worked with the Latino Connection for Latinx communities. And there are many other communities to talk about. So I think that we have to work from within and engage local stakeholders.
Great, thank you. Dr. Rattay or Dr. Sharfstein, do either one of you want to add to what Dr. Levine just said?
I would just emphasize very quickly the importance of being in a listening and answering questions mode, not in a lecturing mode or, what's wrong with you kind of mode for some of these discussions. And you really need to have time. You need to have, just like Dr. Levine said, good people with you who are well known and respected in communities, but come and really listen and talk. And I think the time for that, the outreach for that, I'm worried that that's the kind of thing that will get lost if we're only measured on the number of people vaccinated.
Thank you. Dr. Rattay, anything else you want to add?
Yeah, I mean, I think they both said it well. There is so much pressure right now on us to on the numbers of people that we're vaccinating, and get that. But that focus is going to leave people behind. And we have to work with communities. And some of this work is a lot harder. It's more resource intensive, and we're not the ones who should be in the driver's seat, but we have to enable and support those kinds of efforts as best as possible.
Great, thank you. As you all can imagine, we're getting a lot of questions in the chat box and the Q&A box about the vaccine. So I'm going to lump a couple questions together, and Dr. Rattay, if you don't mind starting with you. Do you anticipate any changes in the rollout plans that have been released so far in your state, particularly related to the tiered approach, who the priority populations, and or related to the 1-dose, 2-dose, release of vaccines? Yesterday, we heard from Dr. Wen, who really is opposed to sort of the mass release of the vaccine, making sure everyone gets the first dose, and sort of worrying about the second dose down the road a little bit. So just want to hear if in Delaware, do we anticipate any changes to your current plan?
Yeah, it's a great question. I mean, I'm in support of the science, and we need to look to the science to guide us. Right now, 2 doses are how we need to go about this. Now, I will say we are getting away from delineating first versus second doses, and we are just trying to get the vaccine out there as quickly as we can, with some assurance that Rachel and I received yesterday that the supply pipeline looks good. But we are, we're going to continue to do everything we need to ensure that second dose is available for people who get the first dose. As far as the rolling it out and the tiered approach, we know that people are eager to move us forward, and we get a lot of hits for, we're not moving fast enough, but we've spent a lot of time with an ethics committee really looking at, what's the best way to roll this out. And at this point, we are going to stay true to that. But I will say we're really, really eager to get our 65 and older folks vaccinated as soon as possible.
Great, thank you so much. Dr. Levine?
Well, thank you. Yes, everyone's all about the vaccine right now. So we are, again, as Dr. Rattay said, we are committed to a 2-dose regimen. So we have to follow the science. The science, that then the studies that were done indicate that the 2 vaccines are safe and they're very effective with the schedule that was studied. And so we're going to be following that. We want to make sure everybody gets their second doses. We are following the guidelines of the Advisory Committee on Immunization Practice from the CDC, and we have been working right now on 1A, which are healthcare personnel as well as seniors and staff in long-term care facilities. With the new federal announcement of opening up to 65 and older and those with chronic medical conditions, we're working on how we're going to implement that. But yeah, soon we will be opening up that population as well and having it overlay the 1A mission. We also, though, have to take into consideration the frontline essential personnel, those first responders, et cetera, and make sure that they're in the mix as well. So, as Dr. Rattay said, talked to Dr. Perna yesterday. I mean, we only get so much vaccine, and we can ask for more, but the answer will be no. We get pretty much what we get. So it is a balance, as others have been saying, between making sure that we do get vaccines into arms as quickly as we can, versus making sure that we don't highlight individuals of privilege that could get in line much quicker, and that we forget underrepresented vulnerable communities where, as it's been said, we have to spend more time and we have to cultivate those relationships. And so that is a balance, and all of us in the states and territories and cities are working towards that balance.
Thank you so much. And I know we're at time for this panel, and we'll certainly understand if our speakers have to leave, but if you can just hang in there for one more question, we'll make this the last one. And as I'm asking, I hope you're reading the chat and feeling all the love and admiration coming at all 3 of you from our attendees today. So with that, we've spent so much time talking about coronavirus. We'd love to hear from each of you what some of the other either existing or emerging public health issues you're keeping an eye on this year. Dr. Sharfstein, let's start with you.
Well, I think the overdose crisis would be at the top of, or at least very much on my list. There are others. Maybe I'll give one other, but the overdose crisis has gotten as bad as it ever has been. There'll be more than 82,000 people who have died of overdose in this country. And while that's a lower number than COVID, it actually, when you think about years of potential life lost, because many people are quite young, it's enormously substantial. And we've fallen behind in providing access to treatment, in providing harm reduction, in really embracing the approaches other than criminalization for drug use. And I think that there's going to be a lot of work that needs to be done to really set that area of public health on a better track. The other one I would mention is community violence, which I think is a major public health issue worsening in many places. I'm also deeply in need of support from the public health community using data, evidence, and all kinds of creative policy solutions and programmatic solutions that are outside traditional law enforcement to be successful.
Thank you. Dr. Levine?
Well, thank you. Yes. So, all of the activities in public health for our department are all continuing, even in the midst of the COVID-19 crisis. I mean, our staff are working from home, but, addressing the opioid crisis to the best of our ability is continuing. Maternal child health is continuing. WIC is continuing. Environmental health activities are continuing. So all of that work continues with really fantastic staff working very, in a very challenging way from home. I would agree and with Dr. Sharfstein that I think that the opioid and overdose crisis is absolutely critical and is worsening, which is very challenging given all the the progress that we hoped we had made previously. It was exciting to see an announcement yesterday about more access to medication-assisted treatment or medication for opioid use disorder. I would also add mental health in general. and that I think that we are going to see significant rates of underdiagnosed and undertreated mental health after the dust settles, so to speak, from the pandemic, after we get work past things, depression, anxiety, PTSD that has been undiagnosed and undertreated. You know, I mean, we know what we've had to do with many schools, but one of the downsides is that many children, I think, have not received the attention from a mental health point of view that they'll need. So I think that's going to await us as we move past the COVID-19 pandemic.
Thank you, Dr. Levine. Dr. Rattay, last word.
Yeah, I mean, one of the things that keeps me up at night around this pandemic is the lasting impact that this is going to have on our equity issues. And so, you know, I think a lot about the impact of lack of good education for so many of our kids in schools, and the job and income situation in our communities, even housing. I mean, the impact that this pandemic has had, I think we're going to see for you know, it could be decades. And the hardest hit communities are the ones that we were most concerned about before this pandemic hit. And so I think that's, you know, it's great to see that there's really a lot of mobilized efforts around addressing equity and racism. And I, you know, personally, and Rachel, Dr. Levine already mentioned this, but maternal and child health and the really unacceptable inequities that we see in birth outcomes and maternal outcomes. You know, I mean, I'm worried that this pandemic is even going to make that much worse, and we're going to have to even apply more stronger concerted efforts to addressing equity after this is over.
Thank you so much. And thank you to all our esteemed panelists today, Dr. Rattay, Dr. Levine, Dr. Sharfstein, Dr. Fernández-Peña. I hope you know how deeply we appreciate your leadership and how inspirational we find all of you to be. And with that, I'd like to turn it over to Brooke, who's going to take us out with a live poll before all of us rush off to the 10 o'clock sessions. Thank you. Brooke?
Thanks, Stephanie, and thanks to all of our amazing public health leaders who spoke today. So in just a second, you're going to see a poll going up with just a few questions about how the conference has gone so far, how you're feeling, and we'll try to keep this pretty quick so that we can all move off to our 10 a.m. sessions. And if you didn't see the announcement this morning, I'm happy to say that the yesterday morning's keynote panel has been uploaded to YouTube, so you can definitely check that out at any time. Like we have most of the results in. And thank you all for participating. Great.
Wow, the results are always so fascinating. Thank you, Brooke.
Racism as a public health crisis was a really big hit yesterday.
Yeah, all the sessions I've heard, you know, were so phenomenal. The ones we're in were amazing. So again, thank you all so much. Don't miss the sessions today. They're going to be amazing, and they are about to start. So we'll close this one up. Thank you all so much for joining. I hope you found it as fascinating as I did, and have a great day.